Good afternoon, and welcome to Direct with the Director, our first episode in the year 2021. As we knew at the end of last year, COVID-19 remains to be an issue within our community, within our county, within our state, our country, and the world. And we continue to ask everybody to remain safe and remain healthy during this time when we are dealing with the push out of the vaccine and the vaccine system. We are asking everybody to remember to wear your masks, socially distance, avoid large groups of people, sanitize, wash your hands or use hand sanitizer. And if you're sick or a family member is sick, please stay home so that we can continue to try to reduce the amount of people that are coming up positive while we walk down the path of the vaccines. I hope that everybody had a happy new year, and I hope that you, your family, your friends, and your loved ones remain safe and healthy during 2021. Today with me is Dave Richardson, our PIO at the Emergency Operations Center. Dave?
Director, it is a new year.
It is.
But unfortunately, we still have positive cases.
Yes.
Today we had 121.
Yes.
You've already said what we need to do. We need to continue to do that. We'll come back to vaccines in just a moment. What that means when there are these number of cases is the Florida Department of Health, Nassau County, has to do contact tracing.
Yes.
There is a way we, the public, can help FDOH do this contact tracing through a website. Can you fill us in on that a little bit? What's the website? How can people help?
Sure. It's actually an app. You can go to the App Store or Google, and you can search it on Florida Department of Health or Healthy Together, and it will come up with the app. You download the app, and if you do become a person who is exposed or test positive for COVID-19, you can put in the information of the people that you've come in contact with since you believe that you were exposed to the virus. And it takes out one of those steps that the Florida Department of Health has to go through, because it is going to not be hours. It will be probably days based on the amount of positivity rate that we have before the Department of Health is able to reach out to everybody, again, with them doing everything else that they're mandated to do.
Before we move to the subject of vaccines, which is everybody is aware that we're doing now, and lots of comments. We want to provide a lot of information, but staying with this, the number of cases doesn't seem to be slowing down a lot anywhere but Nassau County.
Right.
121 today. Have you had conversations with Dr. Seidel, others, about why in Nassau County? What's happening? Why are we not slowing it down?
Sure, and that's a great point. It is continuing to rise throughout the entire country, throughout the rest of the state, and of course in Nassau County. And yes, I have had those conversations with the health department. It's a combination of things. We're not seeing super spreader events that we're able to identify. We can't tie this down to that there is a event that 300 people attended, there was a super spreader there, and we have 300 cases. What we're seeing a lot of transmission of the virus at the house. Somebody within the house becomes infected through their dealings on the outside, be it social events, work, just regular contact with people, and then they're bringing it home to their family, and they're giving it to their wife, their husband, their grandparents, their children, and that is how we're seeing the spread now.
And statistically, for every positive case, the statistic is that we might give it to how many other people? It's
two.
Two.
Two is what the
so it doubles.
Sure.
Right, the number of cases possibly if you
Sure.
were exposed to someone else. Okay, let's talk about vaccines.
Okay.
Monday we started a process where we had a very limited number of vaccine available in Nassau County. And the good news is that process, for the 2 or 3 days that we've booked appointments works.
Yes.
But it's very limited numbers of vaccines that have been made available to Nassau County.
Yes.
First of all, talk about the process a little bit, why we're using this particular process, and then I'll ask you some more questions about, why people are frustrated about it.
Sure.
So talk about what we are doing and
Sure.
why it works.
Well, the way we have it set up is that we send a notice out through Nixle, one of our platforms that we're able to do alerts, and other social media, and on our onenassau.com website, that we are opening up registrations for the vaccine at a particular time, be it 10 o'clock in the morning or whatever time. At that time, we set up a Eventbrite page that's got a number of possible appointments or tickets that are available. Like you said, Monday it was 100, Tuesday was 400, Wednesday was 350. So it's going to vary in days and in amounts each day. People are able to go to the onenassau.com website and hit the link to seek an appointment, and it will take them to the Eventbrite website, and then they're able to register for a ticket to.
And
to
that
be able to
says
call back.
get a ticket when they're available.
Sure.
Right now.
Sure. Once they get the ticket, then this week, they've been able to call into our Citizens Information Center. We've had it manned with quite a few people, and set an appointment. We've got the information on the available appointments. We advise them on what appointments are available, and then they're able to take a slot. We are looking to tweak that in the future, but that's
Okay. Let's talk about the frustration, but part of that frustration is trying to deal with the very limited numbers. You mentioned 100 doses were available for appointments Monday.
Yes.
That took how long for those to be gone?
Around 3 minutes.
Tuesday we did this and we had 4 times the number of doses, 400.
Yes.
How long did it take for those to get booked?
Around 60 seconds.
60 seconds. We did this Wednesday. We had how many?
350.
And how many people were going on our website during that period of time? We had 1,100 the day before, 1,200. Our system slowed down. But eventually, how many people came to our website?
During the time frame of people being able to sign up, it was in excess of 15,000.
15,000 people trying to get 350 doses. We understand, do we not, how frustrating it is that 27,000 seniors, 65 and plus, in Nassau County are trying to get so many limited numbers available to them.
Sure.
What do we do? How do we tweak this to make it better?
Well, the way we're going to tweak it and make it better is by utilizing all the aspects of Eventbrite. Next week, when we go through this process, people will be able to go on Eventbrite and schedule their appointment at an allotted time without having to take the extra step to call into the call center. So when they hit the Eventbrite website, they're going to be given a series of options of time frames to be able to sign up for. There will be buttons on each one of those time frames, and if they're lit, then they're available, and if they're not lit, then they're not available, and they can pick those times to go and do it. So there won't be a need to call into the call center, which obviously when you're dealing with 400 or 350 appointments, even though we have quite a few people here answering the phones, it still can take quite a while to get through that process. So hopefully this will streamline the system.
But it's still a limited number of doses. We don't even know yet today how many doses the state and then Nassau County will receive next week, do we?
Correct. It's going to fluctuate over time, and part of that is because of production of the vaccine, and then part of it is how many vaccines the federal government is going to provide to the state, and then in turn the state government is going to give to each individual county. So it's going to fluctuate in amounts, and it can fluctuate in time frames too. It might not always come in the same time every week, although we do anticipate that for the time being, we should see on near or at weekly basis some vaccines.
Okay, the Florida Department of Health is the one that receives notification about the vaccine numbers.
Correct.
We are helping the Florida Department of Health go through this process of people getting appointments to get their vaccinations.
Yes.
How does the Florida Department of Health know when or how many vaccines we're going to get?
Sure, good question. The Florida Department of Health has a logistics network, just like emergency management has a logistics network. So Tallahassee's headquarters of Florida Department of Health advises the county Florida Department of Health, in this case, Florida Department of Health in Nassau County, and tells them, okay, this is how many doses you're going to get, and this is when you should expect those doses to be delivered.
What's the criteria for determining how many doses a county gets? Do you know?
I'm not really familiar with the actual formula that is used. I do believe it has something to do with the population. It's a per capita of population.
Okay. One of the other differences in the state of Florida versus what the CDC guidelines and recommendations were when vaccines started was the CDC was recommending 75 plus in age.
Sure.
The governor signed an executive order in the state of Florida to make it 65 plus. So that's an increased number of people still trying to get the limited number of vaccines.
Yes.
Let me move on to, and because I want to come back to something, but I want to go to a couple of other things because I don't want us to run out of any time here. One of the questions that we get in the call center is, I'm 65, I'm 75, I'm 85. I don't know how to do computers. I don't know how to get a Nexel Twix, a text. I don't know how to, my wife is 82 years old and has some disability problems, and I still can't get through your system.
Sure.
What do people do to get help that have a need for help to do this?
And we've understood from the beginning of this that there are going to be some people that don't have access to high-speed internet, don't have access to computers or email, or even some people don't have access to smartphones, or just don't possess the knowledge to be able to use technology the way that some other age groups are able to use technology. So once we put out that a certain target group appointments are available, we ask that if the people who have those deficiencies, that have those problems with being able to do it the way that we have it set up in the normal process, to call our Citizens Information Center and provide your information. Let us know some of the limitations that you have, and we take that information down and provide it to one of our partners for them to reach out to you, back out to you, get some identifying information, and assist you in getting signed up for an appointment.
And one of the other things we have learned during this process for the last couple of days is, daughter, son, grandson, granddaughter, but next door neighbor can also help in
Absolutely.
this process.
And that's one of the first things we ask is, do you have somebody that can help? The person doesn't have to do it themselves. If they've got a granddaughter, grandson, or neighbor or friend that can do it for them, absolutely.
Okay, good. Okay, we've already said the population 65 plus is approximately 27,000 in Nassau County. And we're talking about this is frustrating no matter what because there's so limited numbers of vaccines available to us. There are other ideas that are floating around. Are there other ways that we might do this?
Sure, and we're happy to get that information, people's suggestions on how we can improve the system. We always pride ourselves in the emergency management community as being always flexible, always able to change to what is currently going on. We have to do it through hurricanes and any other disaster, but in this case, for the pandemic. We do take those suggestions. We look at them. We run it through a process of talking back and forth with the staff of the EOC, with the staff at Florida Department of Health. The thing we have to make sure that we're complying with are the legalities of the vaccine. It's a federal vaccine, not paid for by us individually in the county or state. It's provided to the state. The state, through the governor's executive order, has said that our target group is 65 and over and healthcare professionals who are in close contact with COVID-19 patients. So we have to make sure that we're in compliance with those laws that are out there, be it federal, be it state, to make sure we're doing this right and fairly.
Okay, good. That was going to be my next question. Can we set up additional vaccine sites, and would that help?
Sure, we can set up vaccine sites. It's going to be a mobile process through this entire thing anyways. There will be some relatively fixed sites. There will be some sites that move around depending on all kinds of circumstances that are involved. But ultimately, it's all tied back to the amount of vaccine that we have. We only get the vaccine that we're allotted. There's no way for us to get additional vaccine. Now, there's multiple areas that are giving vaccines, but the conduit that we have for the vaccines, we only get what they send us, and that's the limiting factor on being able to administer the vaccine.
Would it change our process if we had additional sites?
Unless we had additional vaccines, no.
Okay. Let's see if there is any hope in the answer you might give to this question. We feel inside EOC that eventually everybody will be vaccinated. It's just going to be a process.
Oh, yes.
What might happen down the road? I don't want to say, a week or 6 months from now, because we don't know. This is an evolving process based upon the levels of production and where they're going.
Sure.
Will we get to the point where people can just be notified that there's 5 sites somewhere and there's enough vaccine now to go around? They can just drive their car and wait in line for a few minutes, get a shot. Is that ever going to happen?
Sure. That is going to happen eventually. In fact, it will eventually get to where the vaccines are available in places like your local pharmacies, be it big national or just local pharmacies, local doctor's offices, urgent cares. It's going to be much like the flu shot eventually. It will be available in a lot of different locations, and you're going to have a lot of options. Eventually, the supply will outgrow the demand. Eventually, there will be more doses of the vaccine than we have people to give the doses to. The problem is we don't know when that's going to take place, and it's impossible to speculate at this point. But yes, it's going to get better.
So the frustration people are feeling trying to go through this process, it's not really a manpower issue, is it? I mean, if we had 5,000 people in here answering phones or, 15 different websites, it's not a manpower thing. It is the number of vaccine that is available to us.
Sure. It's always going to be limited by the amount of vaccine. If we need to grow facilities, we need to grow the amount of vaccinators that we have, staff here at DOC, that's all going to be determined on the vaccine itself. As we get more, as we have more vaccination areas, we're going to increase the size of everything in the operation.
And I'm, I've got a couple more questions. I'm going to kind of end it, and I want to come back and say, hopefully there's good news because people are getting vaccinated.
Yes,
right?
They are.
There may be, as we go through this, additional methods by which people can make an appointment. There may be other ways that will come to us that we can continue to improve upon the process, even though we believe currently the number of vaccine in Nassau County is still going to remain limited.
Sure. Again, it's being always flexible. We're always looking for that new way of doing this that's going to make it easier, that's going to make people be able to get the vaccine easier. And eventually there will be something out there that will provide that to us. But again, it's going to be based on the limited vaccine.
Special circumstances, questions, people can call us.
Absolutely.
How do they do that? Who do they call? Who are they going to talk to?
Sure. Monday through Friday from 8 till 5, we'll have our Citizens Information Center open here at the Emergency Operations Center. It's a phone bank, manned usually from 2 to 6 people. The number is 904-548-0900. Again, that's 904-548-0900. They'll be speaking to a volunteer or a staff member, depending on what the situation may be, and they'll be able to either provide them with the information they're seeking or get that information and provide it to them.
And just so we're perfectly clear on those people who are answering the phone do not have the ability to book an appointment for anyone unless you have a ticket
Right.
that's going through Eventbrite, correct?
Right, at this point.
So we're not handing out tickets to our friends, our family, our.
No.
It just isn't happening. We don't even know most of the time when the names are calling us in with the ticket number. That's
Absolutely.
the first thing we have to have is the ticket number.
Sure.
So I just want you to clarify, when people are calling in, these people don't have that ability. They can answer questions and direct you to what you might do,
Right.
but that's the best they can do.
Sure. We've tried to remove the human element out of it as much as possible and provide a way that is fair, that you're able to go on no matter who you are, even if you're from outside the county, because we are required to do that, can go on and get the ticket. And once they get the ticket, we'll provide them with the appointment.
And that's an interesting point you just made. Someone from, somewhere else in the state of Florida can call here and try to get an appointment, can they not?
Or even outside the state of Florida.
Okay, so why? Well, if you're here in Nassau County, you say, wait a minute, how come these vaccines are not just for us in Nassau County?
Well, there's multiple reasons why. One of the reasons is it's a federal vaccine, and that's part of the federal vaccine program, is that we're trying to get as many people vaccinated as possible, and no matter where they're from. The more people vaccinated, the closer we get to herd immunity, and we get past this pandemic. In addition to that, it's reciprocity. We've had residents in Nassau County go to Clay County and get vaccinated, go to Duval County and get vaccinated. We had one that said that they went up to Chatham County, Georgia, Savannah, and got vaccinated. Well, they're going to those jurisdictions. We have to be open for other jurisdictions to send us their people also.
I want to give you the opportunity just to kind of end this conversation today, because it's all about the vaccines, and I hope we've given people some information that helps them understand
Sure.
the process, and that we understand their frustration.
Sure.
We're doing everything we can to help get people vaccinated,
Right.
with the limitations that are in front of us.
Sure.
I'll just give you a moment to freewheel here for a
Okay.
second. What do you want to say to somebody that's listening to you right now about this process?
Thank you for that opportunity. What I want the people of Nassau County and the people visiting Nassau County that may be watching this to know is that Nassau County Emergency Management, the Florida Department of Health, our governmental partners, our nonprofits, our faith-based, everybody that's involved in this entire process, we remain committed to the safety and health of the people in Nassau County, be it again resident or non-resident in Nassau County. That is our goal. That is what we are working towards. We do understand it's frustrating, and I understand the frustration of the people that I speak to that are upset that they did not get an appointment. What we're asking people to understand is right now we have a limited amount of vaccine. We are trying to, as effectively and efficiently, push that vaccine out and get it into the arms of the people in our county. This will get better. There will be more vaccine. The companies that are producing the vaccine have come out and said that they're going to be generating more vaccine. But people have to understand that when these companies, they make these vaccines, they're making hundreds of millions of vaccines. They're going out throughout the world. There's 7 billion people on this planet, and a lot of those people rely on the United States companies to be able to get that vaccine. So we're asking people to understand that there is a supply and demand issue. It will get better. Eventually, we will get to the point where there's more supply than there is demand, like we do with flu season from time to time. Just try to be patient. If you've got questions, call in here. We'll be happy to answer your questions, and we'll get everybody through this because we are in this together, and we are one Nassau.
And we assume we'll do this process again next week.
Yes, sir.
We will also be here next week to do this, to follow up, to see any improvements,
Sure.
any other issues, but we will keep doing this every Thursday at 4:30.
Absolutely.
Thank you, Director.
Thank you.